of course. Thank you. This is Amir Qorbani. I'm a pathologist right now as a faculty working at UCSF. I had a project on a new microscopy, and I'm so passionate about. It was developed at UC Davis when I trained my residency over there, and I want to share my experience with you guys. And I had multiple amazing colleagues working with me, which you see just few of them on the author list. So first, again, it's an honor to be here. I'm so happy I can join USERN, and thank you for having me. For disclosure, Dr. Levinson is one of the co-founder of the Muse microscopy, and other authors that don't have any conflict of interest. So just about pathology. Pathology, the power of pathology is to make disease visible. And the way that it do it is just by simplifying, just changing the focus. For that reason, there is multiple types of microscopy they can use. Conventional microscopy that has been around for almost 200 years is require sampling from the patient and grossing the tissue, making thin section, put it in the slide, and see it on the regular microscopy. Ex vivo microscopy, or I can say slide-free microscopy, is a very rapid way. Just you can examine the tissue right after they taking the sample and see, examine the tissue microscopically. The other way is in vivo microscopy, which you don't even need to do the biopsy. It's a biopsy-free method, and you can examine the tissue while it's attached to the human body. So what is Muse? Muse is a novel ex vivo microscopy, which is a slide-free method developed at UC Davis, as I mentioned. It was first, we were first group working with this microscopy on human tissue.
I'm sorry, would you please, I'm so sorry for the disturbance. Ms. Zahra Kermani, I think you should...
Okay, so sorry.
I'm sorry, thank you very much.
Sure. So Muse stands for microscopy with UV surface excitation. The simplest way to describe it is it's use UV light to excite the surface, and then when it excites the surface, it generates a visible light that you can capture with digital camera. So just a very small background, physics background, how they develop it. It's a very simple method that any university can, or any person can duplicate it and use it. After we published the paper, MIT and a couple of other universities, they built their own Muse microscopy on their side, and it's a very fast and cost-effective method. So UV is an electromagnetic radiation wavelength between 10 to 400 nanometer, and it's a little shorter than visible light. And the interesting factor is, depends on the wavelength can penetrate to the tissue. For example, as you can see, the UV light penetrates just very little compared to the infrared. So the interesting thing is 275 or 285 nanometer of UV light can penetrate about 3 to 4 micron, which is pretty much the same as the thickness of the slide that we examine on the regular microscopy. And when it went to the tissue, it can excite the dyes, if we use dye, any dye or any endogenous autofluorescent material. And when it excited, it can generate a visible light. So we don't need a UV or fluorescent specific microscope to capture it. It can generate a visible light, can be seen by naked eye. Then a digital camera can capture the emitted light, and because it's a 3 micron, just excite the 3 micron surface of the tissue, it theoretically can have similar picture than when you cut the tissue and see it in the microscope. So this is the schematic view of the microscope setting. You can put the specimen as it's green over there. The LED light can generate a UV light. UV light just excite 3 micron of that. So we don't need to cut it in 3 micron and to examine it. Even a very thick tissue, very large tissue can be examined. And when it generates the UV light, the visible light, it can be go through the objectives and then the camera capture the picture. So this is the actual prototype that we use. It's not in the, they're not making it as like a commercial right now. This is just research state, but we just need a prepare flat tissue that we put in there here, a specimen, and then the staining, it takes just 50 seconds and it doesn't damage the tissue, and then we can capture the image. For example, here, one of my colleagues, Dr. Farzad Fariduni, help us to take these pictures from the vessel wall, and we put the tissue here, and then you can see the tissue live. And here are other groups that we work on the Muse microscopy. So we did like 4 projects during the last 4 or 5 years. The first one, we just wanted to see if Muse just can see anything. Is it even working? Because it was just a theory. And then we published our report in JCP. This is the paper. It took almost a year. They accept us because they didn't know anything about the mechanism. And when we published the medical data out of it, they said the actual prototype is not even described yet. And then our colleagues published it in Nature, how it's the mechanical wise working, and then the JCP accepted our paper. So the first project was we just wanted to see if the skin, it can show the skin structure. We choose a skin because the skin has different components, like smooth muscle, it can have nerve, it can epiderm, adipose tissue, and vessels. So we thought that it's the best way to start. So we started and we gave the samples a score. If it was didn't show anything, it was 0. If it was, you can identify the structure without the need of H&E, but less quality than H&E, it was 1. And 2, if it was equal as H&E. So this is one of the sections we compare. For example, that the right side is the normal H&E. Normal H&E, we when we cut the tissue traditionally, we have to stain it with hematoxylin and eosin, H&E stain, and it usually has red and blue, 2 color. But fluorescence can generate multiple spectrum of the visible light. As you can see, left side has multiple color. Each color represent a material. For example, here the brown at the downstairs, down side of the picture is a muscle, and on the right side is comparable to the H&E. So the actual images was very, very similar, even for a person who doesn't have any experience with the Muse microscopy. If a pathologist see this and know about the difference just in the color, they can understand. For example, here is the adipose tissue, subcutaneous tissue. As you can see, when you cut this fat tissue in the traditional processing, it has lots of artifacts, and you're not sure some of these vacuole are the vessel or they are actual fat. But here you can see in the 3D 3D way, and also the different color can show you, and the fat globules are kind of are actual globules because we don't cut the fat. So here is another skin. I don't go through all of them. So we score each component of the skin separately to see how Muse microscopy is strong in differentiating or diagnosing or finding these elements. And the score, for example, for stratum corneum, the Muse microscopy was 1.1, was even better than H&E traditional method. And overall 9.4 out of 10, which is very close, and it was a surprise for us how good it can show the macro histology. So then when we decide, when we saw it working, so we decided to see if it works actually in a clinical setting. Our second project, we combined with UCLA. I was at the UC Davis with UCLA, and then we selected among like 30 selected cases among 10,000 cases. And in different skin pathologic lesions like epidermal lesions, melanocytic lesion, pilar sebaceous, cystic lesions, or elastin lesion. And then we took a picture of that disease or that pathology and asked the person who never ever had experience with Muse microscopy, very naked eye, just different stage of pathology training, because they have to be pathologists to see the histology. And for example, we put the Muse microscopy, ask them what is it. For example, this is basal cell carcinoma. And then we compare it with the H&E that every pathologist are trained with, and ask them to compare it together. So we get two different scores. For example, these are the comparison. Right side is the Muse microscopy, left side is H&E traditional. So then even some of the pictures, some of the comparison was very informative. For example, at the left side, it's a pilomatricoma. It's a benign lesion, but sometimes hard to diagnose because you have to find the ghost cells, which is characteristic. For example, this is the H&E, but we usually diagnose the disease on this. The ghost cells here are close to calcification, which is a dark purple. And sometimes because the calcification is very hard to cut, it causes these clefts in the regular traditional cutting. And we miss that, and definitely as a consequence, we miss the diagnosis. But in Muse microscopy, because we don't need to cut the tissue, and we see the cells very nicely in the different color. As you can see, calcification over here is a kind of a crystal dark, and here the ghost cells is a lavender color, which is very nicely diagnostic, and for diagnosing, at least for this entity, is much higher than a regular microscopy. Different lesions. Even the interesting thing is, for example, this is a poroma, and if a pathologist see this and doesn't train in derm path, maybe they think it's just hair follicle, because you see this like a pattern of the hair, and this is the skin. But here you see the maroon color secretion that is in the ducts in poroma, and it's very diagnostic. So even in such this lesions, for example, this is the cyst, and this is the Muse microscopy. You see the secretion inside and the cyst as a 3D structure, which is amazing. Or in syringoma, the same. So in some other cystic lesion like hydrocystoidenoma or statocystoma, you should see this sawtooth pattern. But sometimes you don't, you miss it because it's cut in many areas. Like here, you don't see the sawtooth very nicely. But here at the right side with the Muse microscopy, like here, you see the wall and you see the cystic structure very nicely. So then we ask first, when we ask the examiner what the diagnosis is, if they take it right, we call it as a diagnostic score, which in cystic lesion was 88% of the people who didn't even have experience with Muse microscopy, they got the answer right. The average score was 70.83%, which is impressive. And then when we compare it, we gave 0 to 2 a score. If it's 2, means it's even better than H&E. So the actual score was 0.8, means it's a little weaker in general, little weaker than regular microscopy, but it's diagnostic. And in some area like cystic lesion or adnexal lesion is equal or even more powerful than H&E. Then at the third stage, we just wanted to get in a new field, like not just skin, to see other surgical pathology. And we decided to sample surgical pathologists like colon cancer here, or other like breast, here we compare it, lung cancer, small bowel neuroendocrine tumor. Even you see it at the left side, neuroendocrine tumor. One of the way that we diagnose it on the H&E is this salt and pepperish nuclear pattern on the left side. You see on the right side also this Muse microscopy can show the details. And this is a thyroid. This is lobular carcinoma in situ, and so on and so forth. And even with the, for example, this one is DCIS, ductal carcinoma in situ. You see DCIS, you have to see these bridges and then papillary extension to the ducts. And here in the right side with the Muse, you can see it in the 3D structure. It's very easily to diagnose. And in many examiners saw it as more powerful than H&E. So then when we gave the images to the examiners, we asked them to score it, diagnostic score, and then compare it with the H&E, and we get the diagnostic score of 78.2% correct, which is impressive for a person, because most of the examiner didn't have experience. I didn't include myself or my close colleagues that we were working on developing this microscope, because we had hours of experience, and we could diagnose much faster. But we wanted to see if the microscope is even good for a person who doesn't have experience with this microscope. So the comparison score, and then when they diagnose it, we showed it to the H&E, compared it to the H&E, and they asked them to score it, and 0 to 4, which it was 2.27 out of 4, means it is diagnostic because it's more than 1, and it's not as good as H&E, but in some areas it's stronger, or at least equal. But 2.27, it was a very impressive result. And right now, after this, we are submitting another study for getting the FDA approval for clinical use, daily clinical use. So, what is the pros and cons in Muse versus this new technology versus the old one? Or I cannot say the gold standard, because H&E is the gold standard in pathology. So the cons, I want to start with cons, and then I will just start with the continue with the pros, because I think the pros was much more. Okay, the problems was the pre-imaging processing. For we couldn't change the magnification, the way that it's developed. You cannot change it because of the physics behind this method. We are trying to fix it, but so far we just fix with the 10x magnification, and its limits for some of the diagnoses that require higher magnification. It's hard to work with very small specimens, because H&E, you fix the specimen in the paraffin and it's fixed. When you cut it or examine it, it doesn't move. But very small pieces, like less than a millimeter in size, it was difficult to put it on the slide and keep it to not move while we are examining it. But we had this problem with very small specimens. And the other thing, image, the nuclear features, especially for melanocytes or inflammatory cells, it wasn't as good as H&E. And of course, as I mentioned, the color was totally different. It was full spectrum of the colors, compared to two color that every pathologist trained with. So many pathologists, when they examined it, they said it's very hard for them to go back to the new thing. And the interesting thing is, more recently graduate examiners were much better in diagnosing compared to the my mentors, because they used to two color, and was very hard for them to get familiar with these colors. But overall, it was very impressive result. Post-imaging, the images was extremely large. And right now, with for example, each image H&E, each scan image for Muse microscopy was about 2 gigabytes. And the storage of the tissue also was the problem. But the pros, it's a robust method. It's very simple physical and chemical principle, very fast. In 2 minutes, you can have the image for diagnose, compared to H&E that takes almost 2 days. The fastest phase is 1.5 days. Some institution, it takes 3-4 days to just have the slide to examine. Compared to 2 minutes, it's impressive. And the good thing about Muse, you can work with fresh tissue, formalin fix, alcohol fix, any type of tissue. But compared to H&E, you have to fix it in formalin. And Muse images are multicolor. In my idea, it's more informative because each material has a specific color, and it's 3-dimensional. So for cystic lesion is amazing. And it's similar to H&E. So even without a specific training, people who train in pathology, they can examine and work with this. And it's a very high diagnostic value, even on for the fresh eyes, as I explained before. And it's ex vivo technology, means it's first inexpensive because we don't need histology. There is no need for hiring people, cutting the tissue. Lots of devices, very expensive devices, because you just need one biopsy. And the microscope is around, if it go to the mass production, it could be even close to $1,000 or $2,000, which is compared to regular microscope, it's much cheaper. So it's preserved the tissue. For example, if you have a sample, you don't know what is the patient has a mass, you don't know what is it, and you don't know if you have to send it for flow cytometry, cytogenetic, or any other tests. If it's H&E, you have to do the frozen section. The frozen section damage the tissue, or if you put it in formalin, you cannot send it for molecular testing further on. So in the traditional way, you have no choice but to damage the tissue and then maybe sometimes re-biopsy the person for doing other tests. But here we can examine it without any harm to the tissue and then decide, do you want to send it for molecular or not? And also it has a potential to use intraoperative consultation because it's extremely fast. So if a surgeon want to know if it's a tumor or not, in 2 minutes they can find out. And it doesn't have the artifacts like frozen or damaged tissue. And also it can potentially be used as a point of care device. Like, it's very small, you can put it very simple, there's no training. So a person who takes a biopsy right away can examine the tissue and have the diagnosis when the patient is in the clinic. And it's very fast, and it's digital pathology, so you can provide service to low resources area. So there is no need for a person pathologist to be there, because it all is digital and everyone from everywhere can examine it. And it's beautiful. For example, this is ductal carcinoma in situ, and it's not me that thinks the pictures are beautiful. Even Nature, 2 of the journals, they decided to take our pictures from Muse microscopy at their cover pages. And it's because it's 7 color, it's beautiful. Some pictures, I put it on my screen. Okay, this is the actual setting right now that we used. It is a large because we just wanted to examine if it's the method working, but it can be as small as this. You can put a sample from the patient, put it the staining, and put it on the Muse microscopy, and right away you can see it on your cell phone or any digital device and diagnose it. And I just want to thank all of my colleagues and friends who helped me. We had an amazing group, and I was so passionate, and they helped me a lot, and I'm so thankful.